Hello, friends. Today we are going to discuss the management of cancer patients during these tough COVID times, which is happening all over the world, though much less in India. So, let's see what are the questions in the mind of the cancer patients who are going through this. The questions in these patients' minds are that he is afraid of cancer and COVID. They keep hearing many comments, suggestions, experiences from their near and dear, which could sometimes be misleading them. And they are always wondering as to which is more dangerous. And at the end of it, they do not understand a thing, remain confused, asking themselves as to what should they do. This situation is something like between the devil and the deep sea. I am Dr. Rangarao, medical oncologist, chairman, Paras Cancer Center in Paras Hospitals in Gurugram. I am going to talk to you about the cancer treatment in the COVID-19 times. What have we learned so far? The observations which have been made by the experts are that the cancer patients are a little more susceptible to the infections more than the others. When they have this illness, it is more serious than others. The results are somewhat worse than all others. When I say others, meaning the normal patients. More the comorbidities like diabetes, elderly, and heart problems, and so on, worse are the results. What have been the recommendations? In brief, that every patient of cancer needs a discussion thoroughly on the cancer treatment that he or she is going to have. In case the corona infection happens, they should be treated as intensively as possible. For the people who do not have the infections and they are going out for whatever reasons, they must use the personal protective equipment and at any cost prevent corona, and that's the basic message for all these patients. Prevention includes maintaining a very good personal hygiene, avoiding the coughs and sneezes of the other people as well as yours, maintaining a social distance, cleaning and sanitization of the entire home, using good masks all the time in during your stay at home as well as outside, in case required doing a self isolation, monitoring yourself with the thermometer for the fever and various other parameters, be in touch with the oncologist for any problem, and in case you're going out, please use the personal protective equipment. What would be the strategies of managing the cancer in the COVID times? First and foremost thing is fight the cancer. Do not leave it because it will not leave you otherwise. Prevent corona at all costs, and there are ample methods available to do that. And God forbid, in case the COVID infection happens, treat it as aggressively as possible. Coming to tackling the cancer, how do we do it? I'm discussing in three categories of patients: the patients who have been treated for cancer in the past and are currently cancer free. The second category is the cancer patients who are on treatment right now. And the third is newly diagnosed cancer patients. The bottom line advice to all the patients is do not fear cancer, fight it regardless. So, what do we do in the patients who have been treated for cancer and are currently free? The good news is that these people are at the same risk as a normal person. They are not immunocompromised, so therefore their risks are standard risks. If they do not have any symptoms, you must understand that you are completely safe. But you must take all the precautions to prevent the corona infection. In case you are due for any tests for the cancer, please delay them unless your oncologist says otherwise. Travel in the least, continue all your medicines, Discuss with the oncologist of any problems that you have, especially if you have any kind of symptoms. Please talk to him, and as far as possible, first on the telephone, and only if required, you may visit him. The patients who are currently on treatment, the best advice given by all the experts across the world is please continue your treatment as far as possible. And in case the oncologist thinks that it is safer to make some changes in your treatment, please let him go ahead and do the changes. During the treatment, remember to choose the nearest hospital so that you have to travel the least. Take all precautions against corona, and if required, do the self isolation because that is going to protect you in the best way. For the new patients, the best advice is please do not stress yourselves, do not panic, sit down coolly and understand the situation. First and foremost advice is complete all the tests advised by your oncologist. Sit down with him and the whole team, learn all about the cancer, the type of cancer, stage of cancer, what are the treatment options, what is the sequence, what is the intention to treat, and with the treatment, what are the possibilities of the complications and what kind of complication that one may have. And if you're not happy or if you want to know more, maybe it is worthwhile to have a second opinion. Understand one thing, that how important it is to treat the patient, and if you do not treat the patient, what are the consequences. That will make your mind very clear as to how to proceed. Also consider from the options that you have, is there any safer treatment? After all these discussions, do talk about this in the family, discuss thoroughly, and also the logistics as distance, cost, problems encountered, and so on, and then take a decision. Important thing point to remember is the decision must be in the interest of the patient and not the convenience or any other factor. Important thing to know in a newly diagnosed cancer patient is at what speed is it growing? Is it growing slowly or is it growing fast? And if it is growing slowly, is the patient all right? Is he symptomatically fine? If that's be the so, complete all your tests, and after the discussion with the oncologist, you could choose to wait for the treatment but not for too long. And if the patient is not well or has some symptoms because of the cancer, maybe the best advice is to start him on some treatment, discuss with your oncologist, and what is the best. In the fast growing tumors, proceed with all the tests and the treatment. Prior to that, understand all the treatment options, the sequencing, and decide after a lot of deliberations as fast as possible. Cancer is not going to wait for COVID or for lockdown. Chemotherapy, radiotherapy, surgery, all the treatments are safe provided they are executed properly in a non COVID hospital. The delays of treatment could be dangerous in a fast growing cancer. Please remember that and then decide accordingly. When the treatment is going on after the new diagnosis, how to manage. Kindly choose the nearest hospital to you so that you travel the least, and preferably have the treatment in a non COVID hospital where there is a good expertise and facilities, taking all the precautions for the COVID infection. If required, rather, maybe most of the times, self isolation is one of the best methods of preventing corona. There has to be a good family support and care for each patient. And when you go out to the hospital or any other place, please use the personal protective equipment without fail. What do the experts in the world say about this condition? They all admit that it is a very hard choice. It's not easy at all. And in each patient, consider the age, the stability of the patient, the condition of the patient, type of the cancer, the stage of the cancer, the side effects of the treatment proposed. If it is necessary to treat, please go ahead and treat. If it is not necessary to treat immediately, please delay the treatment. And at the same time, please take all precautions for the COVID infections. The conclusions are please listen fully, question, discuss, understand, and learn about the cancer. Discuss it with the right people, your oncology team, your family members, but please do not fall prey to false beliefs, myths, and wrong advices. And after deliberation, take appropriate decisions, and at any cost and all the time, please follow the advice of your oncology team. And I would like to say stop corona, don't ignore cancer, please be safe, and wish you all the best. And I'd like to thank you for your listening. Any suggestions, comments, questions, the email IDs are here. Kindly get back to me. I'll be very happy to answer your questions. Thank you and wish you all the best.